Welcome back to the Higher Form Podcast. We're here every week having real conversations with leaders, coaches, and everyday people about what it takes to become your best. We know life will test you, and we're here to share practical tips, tools, and relatable stories to help you build the highest form of your life.
This week, we have Dr. Monica Goodman with us. Welcome.
Yes, thank you for having me.
So excited to chat. Let's just do a little intro about you so our community can just learn who you are and what you do, and we'll kind of go from there. So tell us a little bit about what you do.
So I am a orthopedic and pelvic floor physical therapist. I have been back in the Kansas City area for about 2 years. So my business is mobile and virtual. So that means that I'm going into homes and virtual check-ins with patients. My clientele mostly is postpartum and pelvic floor patients, and then also just any orthopedic injuries as well.
Okay, cool. So you said mobile and virtual. I don't know that I've heard mobile in this industry very much. So mobile meaning you go to people's houses and you treat them in there or wherever they want to meet up.
Right. So it's like concierge physical therapy. So I come to you. As I mentioned, I see a lot of like postpartum and pregnant individuals.
Yeah.
And the biggest thing is I wanted to take out one more barrier to care. New moms are like juggling everything, right? You're like juggling like nursing or nap times or just trying to survive. And I just, my biggest thing is I wanted to like take out any like barrier to access of care. So I come to you and like if you need to feed your baby during a session, like perfect, it's right there.
I think that's so cool. I don't know that I've really heard of that at all, especially from a physical therapist. Like that's so unique. I love that.
Yeah, like from my own experience, like I realized like this was something that women needed because so many people were like didn't go to therapy because they're like, I just got my baby down, like they haven't slept all night, like I just can't come, or like I have a toddler. It's just those first few weeks are like, you want me to put a baby in the car and myself and just...
Well, they're already going to like what, pediatrician appointments and just like their gynecology checkup and just like all these other things that they're just trying to navigate and they're recovering. And so one more appointment to take care of themselves, I feel like is so hard for people to like actually go and do, right?
Right. And then another thing is like, a lot of times this is where people are going to do their healing. And so like, I want to look at your environment. Like, where are you healing? Like what like equipment do you have? Like, do you have a home gym? Perfect. Let's get out there and like work in your home gym on what you have. And then now we know like when I prescribe you exercises, like what you have and
what
we
you have access
kind of go from
to.
there.
Or if they're like doing it in their living room and you're just like, okay, here, I want you to be here, use this pillow or just like whatever they need for what they need to do.
Right.
Yeah, that's so smart. I love that. So you also have 2 kids. So you're coming from personal experience of just like knowing that that's such a convenient thing to have for moms in this stage.
Yes.
Yeah. That's it's having kids is such a unique thing. I feel like you don't really know it until you experience it, how hard it is to just like recover and take care and do all the things that you're normally doing. But now you've got like this little baby that you have to hold on to all day, every day for those first few months, right?
Yeah.
Yeah. So with you having children and you having experience in physical therapy, you're also an avid exerciser, right? You're a Boston Marathon qualifier. How has being an athlete yourself drawn you to helping women in this phase?
So I'll kind of talk about like how I even like came to like becoming a pelvic floor therapist. So when I like came out of school, like I wanted to work with athletes, right? So I actually worked in sports med and orthopedics, like strictly, for 8 years. And then when I became pregnant, I was like, hey, like I need to learn more about like the pelvic floor world. I had no like real desire to like change directions in my career, but I just wanted to like selfishly understand more about like the changes that we're undergoing like with my body. And then I knew if I could learn, I could help other women going forward. Well, like fast forward, I had my first daughter and like dealt with pelvic floor dysfunction myself. And what was crazy about that is like I knew I'm going to go see a pelvic floor physical therapist. I remember like calling to get into an appointment and they were like, oh, you know, we have a 6 to 8 week wait list. And I was like, what do you mean?
I need help now.
I need help now, like 6 to 8 weeks. Like I want to be like running, I want to be lifting at that point in time.
Yeah.
So what did I do? Tried to do what was best, went to that appointment, kind of left that appointment like feeling deflated because I was given very little instruction on where to go. Kept doing the work, went to another physical therapist, and like just no one really knew how to progress me from like the table to like athleticism, getting back to athletic like performance. So that's where I was like, if I cannot find it, like I need to build it. Like I cannot be the only person out here that has like struggled with just like being somewhat better, right? You know, I would go to these people and be like, I have symptoms when I try to lift, or I have symptoms when I try to run, and they're like, well, just like don't do that. Like, what do you mean? Like fitness is just as much a part of my life as like eating lunch. Right? So that's when I dove into more coursework and mentorship, went into getting my certification from ICE Physio, which is really a fitness forward pelvic floor certification. And so I learned how to heal myself because like no one else could. And I knew that there was like this group of women out there that were being underserved. And so that's kind of where I took a 180 in my career at that point in time.
Well, and that makes so much sense because a lot of times you're going to be way more passionate about something if you personally experienced it, or, you know, you had to navigate challenges yourself and you're like, okay, there's definitely not enough happening in this space right now. I want to be helping women in this space right now. So you market having like a fitness forward approach. What does that mean in terms of like how you care and how you treat people?
So really that means is like, you're going to come to me and you could say like, I am having leakage or I'm having pain. Okay, perfect. Those are like symptoms that we can address. But I want to know, do you have symptoms when you're deadlifting? Is it when you're like pushing a sled? What are your goals? Do you want to do a high rocks? Okay, like I want to address your symptoms, and then I want to make sure that you're able to get back to what you want to do in the fitness space. If you were to go to a traditional physical therapist, they would say, oh, well, you no longer have pain. Cool. Okay, well, you may not have pain, but you may not be able to do like what you want to do. So I understand like the whole realm of programming, getting people back to what they want to do. And not only do I get them back to that, but like making sure that they don't have issues in the future. Right. So I don't want you to like be discharged and be like, okay, well, I'm going to go to this high rocks. Hopefully I don't start like leaking in the middle of it. I want to know like what you want to do. And then we program around your goals.
Yeah, it's super individualized, right? It's not just the general OB appointment where like you're cleared, you're good to go, and they're just like, okay, what do I do? You know, like can I just go work out now? Like how do you integrate yourself back into activity and exercise, especially if you're somebody who has a goal of running a marathon or going to do a high rocks or something like a performance specific goal that they want to achieve?
Yeah. So I mean, some people would be like, I don't have symptoms until I've like ran 10 miles. I'm like, all right. So like what I want you to do before today's appointment is run 10 miles, right? So I want to see like where your endurance of your pelvic floor muscles are. I want to do an assessment. I'm going to do an internal assessment on you while you're doing a squat or a deadlift. So really taking this entire aspect of pelvic floor physical therapy and then combining it with this fitness approach.
Yeah, no, that makes so much sense. I love that because you're trying to treat in application of like, this is what you want to do. Let's see where things are falling short when you're trying to do this, or when are you getting to that stage of incontinence or peeing when you're jumping or whatever the case is, right? Because those are super common things that people experience.
Right.
Yeah.
So, I mean, that's really what I like to address in these individuals that like before may have just like stopped doing their exercise or like wore a pad or like stopped running at 10 miles or, you know, didn't do a sled push because like they were like afraid of their symptoms. So,
yeah. Well, this brings me to like the myths that you hear in the like postpartum phase is, well, you're just going to pee a little bit when you jump now, or you're going to leak when you go running. Like, obviously that is a very common thing that people say and experience, but that's not normal, right? Like you shouldn't have to experience that.
Right. So, I mean, there are so many myths. And I think like, I don't know if this is a myth per se, but pelvic floor dysfunction is not new. Like generations before us, our grandmothers, our mothers, like our aunts, our sisters, or even our friends, they've all been dealing with pelvic floor dysfunction. The generations before us almost put this black box around pelvic floor, talking about anything pelvic related, because if we don't talk about it, it's not there.
So it's also kind of intimate. I feel like they're maybe nervous talking about it with like friends or something. Like,
yes.
yeah.
So I've seen people like, generations before us just didn't do anything about it because if you don't talk about it, then we don't have to address it, right? So I feel like pelvic floor dysfunction in women is not new. I think that social media has done this good job, and millennials are like, wait, I don't want to just stop exercising because I had a baby, or
Totally.
like, I leak a little, or I have pain. Like, I think we've done a good job of being like, hey, let's address it. Even though it is intimate and it might be embarrassing. Like, this is something that so many people deal with. I mean, 1 in 3 women self-report having pelvic floor dysfunction. They actually think the statistics are more 1 in 2. So
I would
if
bet.
you're sitting around with a group of like friends and everyone's like, oh no, I don't have like any dysfunction, most likely they do, or someone does in that group, right?
Yeah.
1 in 2 has some sort of dysfunction, and it's just people don't want to talk about it. It is intimate, it's private, it's raw. It's something that like sometimes people don't even talk to their spouse about because it does have this component of being, there's like people feel shameful.
It's like a vulnerable thing to talk about with somebody. You're like, I'm not feeling okay down there. Something's going on.
Yeah. And
right?
I think a lot of times, especially with like athletes, what we deal with is like, they're like, well, I'm strong, right? Like I lifted throughout my entire pregnancy. What do you mean? Like, I can't jump rope without peeing. They almost like think that acknowledging that like takes away some of their athleticism.
Like something's wrong and they won't be strong again or something.
So I think that just one of like the myths is just like we don't have to like deal with this, right? Like common does not mean normal, right? But it is something that like we can address and fix as long as people are willing to like take that avenue.
Well, and I agree with you. I feel like I didn't even really know much about pelvic floor PT until I was like getting pregnant and going through that and realizing like, oh, you can take care of these things that I've heard about for years and years, like peeing when you're jumping or you'll never run again or whatever. And I do think social media has done a really good job of having more professionals speak on it and provide content and just get the word out like, hey, we can help you. Like there's things that we can do to help you. But I feel like before I was getting pregnant 5 some years ago, I didn't even really know it was a thing.
Yeah.
I think social media has helped a lot with that.
And I think it's taken a little bit of that like taboo topic out of it, right? Like before you just saw people like sitting on the sidelines at trampoline parks or like only reaching for black leggings. So I think it's taken this like component out of like, hey, I think it's done a good job of telling women like you're not alone in this journey. So like even if like your friends or your sisters are not like acknowledging that they may have had this problem or maybe dealing with that because like it is a vulnerable and like intimate issue.
Totally.
That others are.
Yeah. There's other people in the world that are dealing with it too.
Yeah. You're not alone.
Yeah.
And I think that helps a lot of people of like, I don't have to be alone in this journey.
Yeah. And there's help that I can get. There are things that I can do to improve or make that better.
Yes.
Yeah. So other things that people might not understand about pelvic floor therapy in general is like, is it just for women who have had kids?
No, actually, like everyone has a pelvic floor, men, women, children, teenagers. So I see really like across the spectrum, really everyone. So I see quite a few teenagers, gymnasts are just one category of individuals that deal with a lot of pelvic floor dysfunction, whether that be a lot of that's due to like tension, an increase in pain. I deal with individuals with constipation, just athletes wanting to improve their performance, tailbone pain. Another like group of people I really like work with a lot are women with low back pain. They've done traditional physical therapy. They got better, but they're not good, right? There's something that's missing, and like the pelvic floor is intricately involved with like your core and your low back system. And so I think by going to traditional physical therapy, like they're getting good to a certain extent, but they're missing one piece of the puzzle. So that is another group of people that I work with a lot, and they may have never had children or have no desire to have children.
Or are
either.
just younger in general,
Yeah.
if they're teens or something like that, right?
Yeah. I see people after abdominal surgeries,
Yeah.
tummy tucks. So really, like, there's a huge spectrum of individuals that we see and assess.
So you mentioned it, but men can have pelvic floor issues too, right?
Yeah.
What does that look like for a man? Obviously, they're not having babies or having the same like maybe causes of having pelvic floor issues. What does that look like for a man if they did?
Pelvic floor dysfunction in a man can present as several things, but a lot of times we see it as increase in pain, or we have low back pain. We're dealing with constipation, tailbone pain. One that people don't really talk about a lot is erectile dysfunction. So sometimes that's dealing with them, like working on the musculature and just also working on their breathing and their techniques. So
And relaxing too, because they could be tense and tight from stress and other things too, right? Just like women could be.
yeah.
Yeah.
So we address the whole spectrum, and sometimes it's as easy as like teaching them some breathing techniques or doing an external release where they're like, "Oh, I had no idea."
Yeah. Yeah.
So, I mean, I love that you asked that question, because I feel like a lot of times like people are like, "Wait, men have pelvic floor issues too?" It's
Yeah.
like, well, yeah, they have a pelvic floor. We all have a pelvic floor.
Yeah.
Their anatomy obviously is different, but
Yeah.
they can
It's still
absolutely
there.
have issues as well.
Supporting things and holding tension and whatnot. Well, I'm a Pilates instructor, and so when men come to my classes, I'm like, oh, this is so good for you too, because you're working these deep core muscles and connecting your breath to your movements and stuff. And it's funny because Pilates gets a bad rap. Or, you're like, men doing Pilates, haha. It's like, no, but like everybody can benefit from it. And so I know that's supportive of their pelvic floors too, even if they don't think of it the same way that us women do.
Yeah.
Right?
Because I think a lot of times like people are like, oh, pelvic floor therapy is if you had a baby. I'm
Yeah.
like, yeah, but, comma,
Yes.
it's also for all individuals. I mean, people have pelvic floor dysfunction that may not present as just leakage or just pain.
Yeah, that makes so much sense though. And I like how you use this specific example as like gymnasts too, because like everything that they do is very in line and tight and like just concentrated of tension in their abdominal area. And so I can totally see that being a common place where people are going to have too much tension and get pelvic floor issues.
Yeah,
Yeah.
and people, another misconception is like, if I leak, I'm weak. And
Yeah.
that's not, that's really not true. A lot of times
Yeah.
it's due to like increase in tension. Their breathing patterns, how they brace may be incorrect, or just how they brace at that specific movement. So a lot of times these people respond really well to just some simple cueing and simple exercises to address their specific issue.
Yeah. Which I guess I said gymnast, but like it could be any athlete, any sport where you're in motion and obviously using your core, because you do for almost every single athletic endeavor.
Yeah.
But yeah, that makes so much sense. So tell me a little bit about diastasis recti. I know there's a couple of ways that people pronounce it. I don't know how you pronounce it.
Yeah, diastasis recti.
I know that's a common thing that happens like after you've had kids. Just tell us, what is it, and what, like, generally what can you do to support that?
Oh, okay. So this is like,
opening a can
yeah,
of
you
worms.
did. I was like, so this is something I'm super passionate about. So I
Totally.
think the first thing is, I'm going to oversimplify this, but I think it's
Yeah.
like teaching people what is going on there. So you have your six-pack muscle or your rectus abdominis, which are the muscles in your core. And in between that is a band of fascia called your linea alba. So what happens is diastasis recti is a thinning and a widening of that tissue. So I think what people need to realize is like, this is a wonderful adaptation that our body has during pregnancy at 36 weeks. I don't like to speak in absolutes, but almost everyone has some form of diastasis.
Just because
right?
the belly is so stretched out.
Yeah, the fetus has to have room to grow, and this is a beautiful adaptation that we have. So diastasis recti, clinically, it is the widening of that gap. So objectively speaking, that it is assessed in the clinic as how wide is that gap or how deep is that gap. I will say that wonderful research has come out. A great therapist and researcher herself, her name is Christina Previtt, and that's who I've done a lot of training under. She like debunked this, right? It's all about function, right? There are people that may have a 5-finger gap that don't have any leakage. They don't have pain. They can manage their pressure. And then you have individuals with a 1-finger separation that like may deal with a lot of different issues, low back pain or prolapse symptoms or like leakage with running, jumping, lifting. So the distance doesn't actually have any clinical significance in function.
Interesting.
So that's something I try to tell my patients is like, you may have a 2 to 3 finger gap, but let's look at your function. With that being said, I also understand that there is this like aesthetics piece to it, right?
Yeah.
A lot of people are like, I don't like how it looks.
Yeah.
And there's a lot that goes into that, right? Like we're dealing with like how old are you? How many pregnancies have you had? What's your genetic predisposal to like that increase in like elasticity there? So there's a point like we can get you better functionally. You could do everything and you may still have that degree of separation. Some people don't like to hear that. And that's where, there are surgical options at that point in time. But if I can get someone prior to them even considering a diastasis repair, I'm like, hey, you can go in for a diastasis repair and it gets repaired and it looks good, but like you can have poor function.
Yeah. So you still got to address the root
still have
cause
to
of
address
the
the root
function and
cause.
connection and everything. Yeah.
And then I know you didn't ask about this, but like this is like my thing, but like diastasis, social media, oh my goodness. You have all these people that are trying to do this clickbait things of like, oh, if you do this exercise or this is pregnancy, this is safe, this is unsafe. Like you shouldn't do crunches, like planks will make it worse during pregnancy. Like honestly, that's like all shit, right?
Per individual, right? I mean, depending on how well you engage when you're doing anything.
Yeah, and research has come out and shown that the best way to reduce like diastasis from worsening during pregnancy is actually training and loading the core. So every pregnant patient I have, we are loading the core. We are like doing planks. We are doing sit-ups because functionally that helps decrease the progression of that diastasis.
Yeah.
So if you see someone on social media, it's like, don't do planks during pregnancy because it's unsafe. Like, oh,
no,
you're so wrong.
Don't
right?
take it at face value. Like,
don't take it at face value. Yeah.
Well, and because that's where I've seen some people, the coning and the doming, that's when it's like, okay, hey, we should probably pause and adjust your form here or change exercises because you are putting pressure into that space that's there, right?
Yeah. So, like coning and doming, they're kind of used synonymously, but that is just telling me information. I always like say to my patients, that is telling me something's going on, right? If you're doing a pull-up and we see some coning, that's telling me your rectus is overworking and we're not working, your pelvic floor might not be engaging, or we need to work on your breath. We even see coning and doming in men. We see this, like, it's just telling us that like something in your core canister and your pressure management system is not firing effectively. So we just use that piece of information and then go from there, whether that's modifications, whether that's decreasing your weight, whether that's like changing your form, changing your breath. So it's really dependent on the person. But I think that by taking a lot of fear out of this, like, if you cone, oh my gosh, you're going to have like
stop doing that.
Yeah,
oh my gosh,
you're going to have this like 6-finger separation and look awful. It's like, no, that's not the case. And honestly, like we want to load the core to see what its potential is. Like how much stress can you handle? And then where do we have a weakness in the system?
Yeah. Well, this makes me think like, and you could probably attest to this too, but like you'll even see like CrossFit athletes or super fit people who are lean enough to see their abdominal muscles. Some people might even have a separation, but they're like these super strong, fit people. And that's okay because, I mean, unless they have problems and they're working on it. But like just because you have a separation between your abdominal muscles doesn't mean that you have problems necessarily, like you said earlier. I think about like when you see a ripped guy and maybe he's got his like abs are a little farther apart and he's got some space in the middle. That would be that linea alba.
And
the widening space between the rectus abdominis.
I mean, research is showing that like most people, even men, women, anyone that's had a baby, not had a baby, has about a 1.5 to 2 finger gap for diastasis. So I think by taking some of this like taboo, because I mean, my patients always want to know like where am I at? And it's like, I'll assess it, but let's also talk about you could be doing everything.
How are you functioning with it? If you are, cool.
Right. And like if it is, it's like you may have had 4 pregnancies and 6 years, right?
Yeah.
So you've just put a little more stress. Not me, but
Sounds like a lot.
like it's just like you have put a little more stress on your system, and like let's kind of adjust to where it's at.
Yeah. Yeah. That makes so much sense. So this kind of brings me to like, I mean, obviously pelvic floor connection and pressure is super common with women who are pregnant and postpartum. What should women know going into pregnancy about their pelvic floor? Should they be doing any preparation work or early pregnancy work? Like, what's your typical kind of conversation around that?
Oh, I wish that when you got pregnant or anyone got pregnant, they called me, right?
Right
Like right away. Especially first time moms, you have no idea what's about to come, right? So I love to even just speak to people about what changes they may experience as their pregnancy progresses. So I see you in your first trimester, we're just basically like, hey, do you have any symptoms, right? A lot of times you're having an increase in like urinary urgency and things like with the hormonal system. Your second trimester, you're going through major transformations. That's when most of the growth happens. Like what aches and pains you may experience then. And then third trimester, we look a little more towards birth prep. But as far as like what they can do to prepare for birth, there's several things, right? Like, what are your goals? Are you wanting to have an unmedicated birth? Perfect. Let's work on what that looks like. Let's work on labor breathing techniques, pelvic floor relaxation. Let's also look at what positions that you could use. And then this is something that I bring up to everyone, is sometimes things don't go as planned, right? Sometimes during birth, shit hits the fan.
Yeah.
Right? So I like to best say is like doing birth prep doesn't equal like
The perfect birth.
So what I always talk about is like, you may want an unmedicated birth, but there may be a situation where you need an epidural. So let's go ahead and let's talk through, like, if you need an epidural, what positions that you can like deliver in. You don't have, just because you have an epidural, you don't have to like deliver on your back.
Yeah. Which is a total misconception.
Yeah, it's a total misconception.
Yeah.
And then another thing is like, sometimes 1 in 3 women experience a C-section. I obviously don't want that for anyone, but like if that is a situation that you have to come into and you have to have an emergency cesarean, what that looks like, right? Like, what are your preferences? I think that there's been this big push of like, hey, if we don't talk about it, it won't happen. It's like, well, here's what I want to do is like, we don't want it to happen, right? I don't want you to have a C-section.
Yeah.
But if you do, I don't want that first thought is like, of you having it being rolled back to that room, right?
Totally.
I want you to be able to be like, if you want a gentle C-section or have a clear sheet or like, so I just try to really talk about birth in general and kind of what it may look like overall. So you're not hit with surprises. I feel like most people do better with some knowns, like instead of going into the scary unknown. Because a lot of times birth, you can do all the prep.
First,
you
right?
can do all the prep in the world and it's a new experience.
But even if you've had one, your second one could be a totally different kind of experience because something else might happen or just whatever, right? Yeah. That makes so much sense. So pregnancy and then postpartum, right? They go to their OB. They're like, yep, things are good. You're cleared to start working out. Why is that not the full picture?
So I think that firstly, like a small caveat, I think that sometimes people villainize OBs and midwives for being like, hey, I went to my 6-week appointment. They cleared me for exercise, but I'm leaking. Well, I try to explain to people that like they are medical providers. At that 6-week appointment, they're looking at like, how are you healing medically? How is your bleeding? If you had a C-section, how does your incision healing? If you had any tearing, like how is that healing? They are looking at you from a medical lens. And that's where pelvic floor therapy comes in. You know, they work in the medical realm. They allowed you to have this beautiful baby in birth. And so I think a lot of times people are like, oh, my OB cleared me. Well, they cleared you. And like medically, you look good if they cleared you. But like, what does that look like from a therapeutic standpoint? So in an ideal world, I see my patients 2 weeks postpartum. Again, this is why the mobile and concierge really comes into play.
Absolutely.
So that's vaginal and cesarean, where we start working on things day one. Obviously, I meet you to where you're at. What was your birth like?
Yeah.
Are you bleeding? Or most people are bleeding, but like, are you
Yeah.
having a lot of bleeding? Did you have a lot of blood loss? Did you have any hemorrhaging?
Yeah.
And then we go right there into like, how are you healing? So
Yeah.
we might, most of the time, first day, we're working on how do we activate your core? Let's start to engage our pelvic floor. Depending on the person, sometimes we'll do some squatting with a PVC pipe because, like, newsflash, you're squatting to pick up your baby off the floor. You're squatting every time you get up from the toilet. You are doing a hinge, a deadlift movement when you pick up this heavy car seat, which, like, if it's not your first pregnancy, you also have a toddler at home. So
totally.
I think people are like really scared around this, like, oh, I shouldn't, am I doing too much? It's like, well, are you picking up your 25-pound toddler on one hip, like one hip, and then carrying your baby on the next? Like, okay, well, you can strength train, right? I'm not saying max out.
But you're moving and you're doing life.
Yes.
So you need to
let's do some fitness, right? Like, let's mimic. Motherhood requires athleticism.
Yeah, totally.
So I think that's 6 weeks clearance. If I can talk to people, I'm like, that is medical clearance. They are doing their medical due diligence. And then cue pelvic floor physical therapy.
I think that's great to separate the two. It's like, yes, you got cleared from your OB. Structurally, medically, you're healing, things are good, but that doesn't necessarily mean you don't need additional support with pelvic floor.
Right. That doesn't mean that you're able to like run, jump, lift without pain. And then also, every person's different, right? So research used to say like, no running until 12 weeks.
Yeah.
So you would see these people that hadn't done anything up until 12 weeks or up until 3 months, and then they like go out for a run. I'm like, well, of course you're having symptoms. You had a vaginal birth. Like, your body changed structurally. You gave birth, which is a lot of trauma to the pelvic floor.
Yeah.
So you're having symptoms. I will say that like that is again been debunked. Like, you can run prior to 12 weeks if you're doing all the right things. Some people are ready at like 8 weeks postpartum, and some people aren't ready until 4 or 5 months.
Yeah.
There's so many components that go into that. And I think that the problem, again, like there's pros and cons of like social media, but you see some people that are like doing things that like some people aren't ready to do. I remember like even myself, like watching this like Peloton instructor that like gave birth at the same time I did with my first, and like she was running at like 10 weeks postpartum. I was like, if I were to do that, I wouldn't be able to like hold my bladder. So I just really like to like tell people it is so individualized. We are looking at so many things prior to like you jumping back into like impact, right? We're looking at single leg strength. We're looking at core strength. We're looking at like, are you breastfeeding? Are you sleeping? Do you have support? Are you breastfeeding and you're getting up all night with the baby? Or
so many factors of where you're coming from, where you're currently at, where you started, right?
Yeah.
So you're also a certified pregnancy and postpartum athleticism coach. How is that different from just like a personal trainer working with a postpartum client?
So that certification itself, actually, personal trainers can get. I got it because I wanted to know from the therapy realm, am I programming and how is my dosage for return to sport? So that really helped me with like dosage. But this is a certification that many personal trainers have. And like, I love people in this space. Like, I love personal trainers. I know that you work in the perinatal space in pregnancy and postpartum. And I love that. The more people that we can get to like understand women's health and help support them, the better. And then that makes my job easier, right? So like, I can know that I'm handing them off to someone and they're in good hands that has like knowledge versus like sending them out into the world and be like, good luck, find a trainer that like understands what's going on in the women body and anatomy.
Totally. Well, and I always say like, after you've had children, you are forever postpartum. And so like, if you're working, let's say you're a trainer and you're working with somebody who had kids 20 years ago, it's like they're still postpartum. Like, they could still be having pelvic floor issues even if had their child 20 years ago.
Right. Or maybe they just feel comfortable enough with like this individual to tell them, right? Or like, I'm now having these issues. So you are forever postpartum. And I know people are like, oh, well, I could just like consider it like after 1 year. I'm not.
Yeah. Like I'm good.
What, are you just not a mom?
Yeah. Like, that doesn't translate.
Yeah.
So that kind of brings me to like perimenopause and kind of just like women in midlife, right? So let's say they have or haven't had kids, but they're going through like perimenopause or menopause. Does that impact pelvic floor differently? Like maybe they weren't having symptoms and now they're starting to like have some issues. Like what's that?
Perimenopause and menopause, it's very complex, right? I'm going to try to simplify it.
Yeah,
So perimenopause is really this 10-year window prior to menopause where you're having major fluctuations in your hormones, mostly your estrogen and progesterone, but today we'll really kind of talk about just estrogen.
Yeah.
So that 10-year window is when you're starting to see people deal with like insomnia, the hot flashes, decrease in libido, increase in pain, increase in pelvic floor, dysfunction. And then menopause is really after menopause, and that's when for 12 consecutive months you have not had a menstrual cycle, and that is when you see the significant decline of estrogen. Why is that important? Estrogen is so important. It's important systemically throughout the body, but it's especially important in the pelvic floor. So estrogen is important for increase in blood flow to the pelvic floor muscles. It helps with supporting the urethra, the bladder. It helps with collagen. It helps with tissue elasticity. It helps with lubrication. So when you have this decline in perimenopause and then ultimately in menopause, you start to see pelvic floor problems that came up that may not have manifested before. Also, estrogen is really important for like bone breakdown to help decrease. So you see an increase in osteoporosis as people age, and then also it helps with like tissue repair. So why is it more important at this point in time is like these people need to be strength training, right? Like,
yeah, absolutely.
Even if they weren't before, like every decade after your 30s, we are on a sudden decline of like
Isn't
strength.
it like 2% of muscle or five? Like I forget what the actual number is.
2 to 5%.
But it's a lot, yeah.
And
yeah,
it's
which is
insane,
crazy.
right?
Yeah.
So you're like having these people go through perimenopause and menopause, and their pelvic floor dysfunction may present at that time because they may have been able to get by all of this time without symptoms, but now we have this decrease in estrogen and we have a decrease of support of those structures.
Yeah.
They may or may not be strength training. So if they weren't, like maybe they were strong enough or compensated enough through life where they didn't have issues, and now they do.
Yeah, that makes so much sense. Yeah.
So this is like you guys, the strength training is like what you do, but like this in this population, like these women need to be strength training more than anyone else.
Yeah. And I think there's a lot of chatter about that right now in
Yes.
the fitness space. If you're online, like you'll see a lot of people saying like women, especially because generally women need a little bit more coaxing to get into it if they aren't already into it, to be strength training
Yes.
in your midlife to later life. It's so important for bone density and hormonal regulation and all of it. Yeah.
All of it. And then, you know, I think that's like with like you like working in the space and working with women, I think like it's really important to, you know, take out the fear. You know, some of these like older women are like, but I've never lifted. You want me to just go and pick up a barbell? And it's like, that's not always what strength training looks like. So let's meet you where you're at, right?
Yeah, it's not where you have to start.
It's not where you have to start. Like probably going to get you under a barbell.
Yeah, that'll be
at
the
some
goal.
point in time. You may not want to hear that, but just kind of like trying to meet them where they're at. If they've never done strength training, we're probably going to start with some body weight squats, and that may humble them, right? But like,
and dumbbells and work your way up, right? You're not just going to throw someone under a barbell the first time that they're in a gym.
Right.
Yeah.
And like, we just want to like meet you to where you're at and then help improve your function from there.
Yeah.
But I think there's like a lot of chatter in the space of like, perimenopause is so scary. And you know, it is. But like research is like coming to support like all of these things. I know I spoke about estrogen, but another thing is like I talked to my patients about is like, call your OB, call your midwife or your provider. Like you can talk about like vaginal estrogen. A lot of times like you use vaginal estrogen that can help support those tissues locally to help, you know, it's not going to like stop perimenopause or stop all the symptoms, but it can like improve your quality of life drastically.
Yeah, for
and
sure.
it's just another one of those things is like, I feel so fortunate that sometimes I get to be the one person that can give them this small caveat that may change their life. It may help them not have pain, or it may help improve their sexual function.
Just the quality of their life as they continue to age. Yeah, absolutely. No, I think that's so important to recognize too, because I think pelvic floor, a lot of people think just, oh, pregnancy, postpartum. It's like, okay, but you might start seeing symptoms later in life, and it's not normal but it can happen, and there are things that you can do about it because it might happen to you.
Yeah,
And
this
don't be
is
surprised if it does.
and this is not something like
Yeah.
you have to be scared of, right? Like
Yeah.
there's help and there are people that are like wanting to help you.
Yeah, definitely. And I think, again, we said this earlier, but I think it's such a positive that social media has been a big opening door for this topic of conversation for women. I think that they're recognizing that there are people that they can talk to if their OB or gynecologist isn't giving them enough, because obviously that's not their specific specialty necessarily. So
Yeah, and they get very limited time with you, right?
Yeah.
Like they're delivering babies, like they're
they're in and
doing
out.
annual exams. Like they don't you may have like a list of questions and then get frazzled in there and not be able to answer them. So
Yeah.
I always say, like, I hope that I can answer your questions. And if I can't, I'm going to try to find information and talk to colleagues and talk to other people in this space and help get you some answers.
And learn.
Yeah.
Absolutely. I think that's great. So you work mobile, you work virtual. Like, what does a typical appointment look like with you? Like when someone comes to you and they're like, hey, I'm having some troubles with X, Y, or Z. You don't have to get specific, but what does that look like? Like, how do you start treating somebody?
So, your first appointment, we start by doing a lot of talking, right? I want to understand everything. For simplicity reasons, we'll just say you're a postpartum patient. So, you've had a baby, doesn't matter when. I want to know, what were you doing prior to pregnancy? Did you strength train? Did you work out? Did you have any issues, like urinary issues? I always say, were you one of those people that always had to like pee right before your workout? Did you really have to pee? Kind
Just
of
wanted
thing.
to let it out
Did you
just in
feel
case.
like you nervous? What kind of habits did you have prior to pregnancy? Then I want to understand your pregnancy. I want to understand like what you did, what complications you may or may not have had. Then we talk a lot about birth. Like sometimes this is the first time people get to share their birth story. I think it's very important in healing for people to share their birth stories. Sometimes it is a positive experience and sometimes it's a negative experience and sometimes it's a lot of both. So we talk a lot about your birth story. When I say talk, I do a lot of listening. Right? Like this is me listening and trying to understand and gather as much information as I can. But then we go into your postpartum. How is your support? Do you have childcare? Are you watching multiple children? Are you breastfeeding? Are you struggling with breastfeeding? Are you having any, do you have like spousal support? Is like, do you have a village? I know that's like a big, do you have a village? Do you have anyone like helping out? So we try to understand a lot of different things. So I want to understand really the whole picture before we even dive into stuff, because like if I need to, like we may need to step back and be like, well, you don't have any support. You're not getting any sleep. So let's talk about like, is there a way that we can get you some support or change some habits there? So that's just kind of, we really start by, I just want to gather as much information as I have. I also want to know about like any history of orthopedic injuries. And then we go right into an objective assessment. So I look at all of your movement patterns. I want to see you squat. I want to see you hinge. I want to check your core strength, your glute strength. This is a lot in one session. And usually, well, all the time, if you see me, you are not going to leave an appointment without some sort of intervention, right? Like I'm giving you something on day one that you're going to start working on. So we work on some exercise at that point in time, kind of where you are. Another thing is we can go into doing an internal examination. I will say sometimes that first visit, like that's something like we don't even get into. Why? Well, there's a lot that I need to assess. And then also be like, I want you to be comfortable with me. I want you to understand what an internal examination looks like what it entails.
Again, another very vulnerable, intimate kind of thing for somebody to open up to.
So it's something that like, I want to make sure you're comfortable with like the exam itself. I want you to like, if we've never met, you feeling comfortable with me. And then that's something we usually do in another session or that first session. I would say most of the time we don't get to it in that first session because there's just so much that I'm looking at.
Well, so that sounds like a very comfortable way to just kind of like we said, get somebody introduced to such a vulnerable topic that maybe they're already uncomfortable with. It's like, look, let's just chat. Let's learn your story. And then we'll kind of go from there and figure out where we can start depending on where they're at, because everybody's going to be in such a different place.
Yeah.
Yeah.
And I really think it's very important to these, like women to get to like share some of this. Like, I don't know about you, but like, I didn't really like have anyone to like tell my birth story to. And like,
Yeah.
that would have probably been really beneficial.
Yeah, absolutely.
You know, it's like, you know, your husband's there and
Yeah.
then like, you don't really have time, or like no one really like asks. It's like, how'd it go? It's like,
Yeah.
well, do you really like,
It's like a long story. Do you want it all?
do you want
or
it? Yeah. Like,
how intimate do you want me to
you
get?
just say like, good. Is this a rhetorical question?
Yeah,
Or like,
yeah.
do you want to know like the nitty gritty?
Yeah. Like, I'll sit down and talk for an hour about it. Or do you just want to hear like, it's good?
Yeah. Is it like, how was your weekend? Good.
Yeah. 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 Like,
So I really like, that's where I really try to like open up that space and
Yeah.
open up this like, what do you want me to know?
Yeah.
And like, the more I know, the better I can treat you. I also want
Totally.
to know, like, did you have any like history of like issues in sport growing up? Like, did you have any leakage and now it like got worse during pregnancy and you just didn't want to tell anyone?
Yeah.
So
Yeah.
really a lot of things, like, I'm probably going to ask you questions that are like going to make you think and are like might be uncomfortable. And it's
Yeah.
okay. I would say, like, if you don't feel comfortable telling me today, that's okay.
yeah, we'll work on it.
Yeah, it's a
We'll get
very
there.
private conversation.
Yeah. Yeah. No, I think that's great. So obviously supporting somebody is very dependent on where they're coming from and just learning a lot about them. But if there was like one practical takeaway that you could share with anybody right now, what is a pelvic floor supportive tool or exercise or tip that like could benefit from?
I would say, like, wherever you are in like your journey, pregnant, postpartum, perimenopause, not having kids, going to have kids, like, you need to strength train.
Yeah.
Like you have to strength train, and you need to strength train for life. If you are a woman, you need to strength train. If you're a man, you do too.
Period.
But
End of
yes,
story.
like, well, yeah, it's not even like if you're a woman, like everyone
Yeah.
needs to strength train, and
Yeah.
like the pelvic floor obviously only like improves with increase in strength. So,
Yeah.
and that's like global strength, right? The more like you can improve like your core strength or your arm strength or like activation or knowing where you are in space.
Yeah, definitely.
So-
Proprioception, balance as you age and stuff too, right? I mean, I feel like we work with a wide range of age ranges for our clientele here, but as you age, you lose balance and you lose proprioception, and so just to practice it in a controlled space, so then when you are out in your daily life, you feel more comfortable going up the stairs by yourself without holding onto the railing, or getting up off of the chair or the bed without, somebody helping you, or, just simple things like that. Yeah.
And I think that's a really important thing. Like, some people are like, well, I don't need to squat. I'm like, but do you get up from the toilet without like using a bar right now? Because like that's a squat.
Yeah.
And like, how can we make that more efficient and safer?
Yeah. I think people just not everybody thinks about it in that way. So
Yeah.
I think that's a good reminder that you are doing activities every day throughout your day. So let's get you stronger in that range of motion so you feel better doing it.
Yep.
Yeah, definitely. So you're a mom of two. You've got young little girls. You run marathons, which is so awesome. How are you taking care of your health? Because and your strength training and your pelvic floor maintenance, like, what do you do to continue to take care of yourself?
So my whole perspective on exercise has changed really since having children.
Yeah.
I used to like do endurance sports, still enjoy running, and I do run. I just don't train for marathons at this point in my life. Why? Because like I just don't have time.
Yeah.
Number one, and number
Time.
two, it's just like not really something that like is that enjoyable, because like strength training is like, I have a home gym. I have my daughters out there with me every day, right? Like them going out to the gym with me is just as much as part of their day as eating lunch, right? They are like, all right, mom, are we going to exercise? They have their little kettlebells. They have like, their little weights out there. And it's something that we do together. I don't want to like separate like this big portion of my life from them.
Yeah.
Obviously I enjoy working out by myself too, but it's something of a space that like I feel very, strongly about, like teaching women the like being strong is advantageous in so many different avenues. There's like,
Totally.
I don't want them to feel like they need to shrink themselves. I don't want them to look later in life and be like, exercise is punishment. I mean, I grew up in the 90s, like moment on your hip, forever on your, or moment on your lips, forever on your hips.
Yeah.
Like
nothing tastes as good as skinny feels.
And
like,
it's like, what are you talking about? And I think like a lot of that was like, oh, you exercise to get smaller. You exercise to shrink yourself. And like, oh, I'm not going to teach my daughters to do that. I'm not going to teach them that exercise should be something that they need to do to earn something. So I strength train 5 to 6 days a week, still run. Most of my running is done with a stroller or early morning, which my gosh.
You can sneak out if you can.
But they're like usually like, hey, like, getting themselves in the, we're all going. So it's just something that like I really didn't want to separate exercise like as something mommy does without you, which I do. I do without them, but it's very much something like on Saturdays, our whole family's out there and we're going to like, they know what pushing a sled is like. They hop on like, this is very much, I want them to like grow up around this and be in this. And like, we never speak about our bodies of like, well, I have to do I have to burn X amount of calories because mommy ate pizza.
We
I
had cake last night, so we got to go work out today. Whatever it is.
So like our children, like far before they have social media, they're being influenced and they're being influenced by every single thing we say or do, whether like we want to admit it or not.
Definitely.
So like the better like positive influence I can be on my daughters, like I'm setting them up for success. Like when they go out into this ugly world where sometimes things aren't as
they're
like,
on their
nice
own and they're taking other influences in, so they get to have their own kind of base of just confidence in decision making because they're growing up in an environment that's supportive of taking care of yourself.
And I'm sure you feel this way with like your boys as well. I love seeing like your post where like your boys are at the gym. I'm like, I love that. Like they're
growing up in the gym, that's for sure.
They don't have to have this separation of like that's where mom and dad go.
It's like, oh, we go to the gym too. And we've got a little like weight set in our garage because we have a garage gym too, just because we actually started out in the garage. But so it's like if we're getting a workout in at home, we set the cones up and they're doing their own thing while we're doing our thing. And it's just it's the activity. So I think that's so great. It's a great influence to be exercising in front of your kids, with your kids, and just showcasing that taking care of yourself is a positive thing.
And like there's nothing negative that comes from like more family time and around of like positive influence.
Totally. Like if you're going to do it anyway, just have them out there, you know?
It comes with a lot more interruptions. Like I'm not going to sit here and lie and be like,
a little longer.
It's like, like sometimes like we have to like shift and be like, all right, like bubbles or chalk.
Totally.
But at the end of the day, like I think I posted this on my Instagram story of like, oh, one day I'll miss little reminders in my gym.
Your little
like,
duck. I saw that.
Rubber ducks.
Yeah, you're like, one day we won't have these little trinkets hanging out in the home gym.
And that like,
I know.
That like hurts my feelings. I'm like, what do you mean I'm not going to have like little like footprints across our like floor that they step through chalk?
Yes, it's fun. It's special. And I think it's a great thing. It's a positive influence for them at this age, starting it so young. They're just like always going to know like, well, this is just what we do at our house. We work out and we take care of ourselves and we feel good, you know?
Like, what do you mean? Like, I always want them to like never be like, oh, like, well, I don't know if my parents can do that. Oh, what do you mean? Like, I'm going to beat you. We're going to go hike up this mountain.
No,
so I never really want them to like kind of like wonder like, is my mom and dad capable? You're
like, no, we're going to be the parents when you're older and at your sporting event, it's like Parents' Day and we're going to be showing everybody up.
I'm like, I'm already preparing for like Parents' Day like 10 years in advance.
I've seen some funny videos about like parents, you know, competing on Parents' Day and they're just like smoking. And I'm like, we're going to be those parents. We're kicking everybody's butt because we've been taking care of ourselves for 30 years, you know?
This isn't like I started training 2 weeks ago because I found this out.
No, we're training for longevity. Absolutely. Well, this has been so awesome. I've loved everything that you've said. I think this is information that people need to hear. So I'm so excited for it to get out here. But you are actually hosting a little workshop seminar here at Avexia in like a month. Tell us a little bit about, you don't have to give away all your secrets, but like what can people expect if they want to come to it?
Like firstly, thank you so much for like giving me the opportunity to like host a workshop at your beautiful space. But I think something that everyone can walk away with is I'm going to give you real world tools that you can apply from that day forward. Right? Like it's not going to be me just like talking, right? I'll be talking, but like we're going to go through exercises. We're going to see like how you're bracing, how you're breathing, and then use those principles. And I hope that you can continue to use them in the gym going forward. So that's one of those things. And another thing is I try to use these workshops as like, this is your opportunity to ask me questions. You don't always have access to someone that, you know, may have this public floor knowledge. So like, pull me aside after class. If you don't feel comfortable, send me a DM before or after class. I would love to like answer any question that maybe you didn't have the opportunity to ask, or you've asked Google and you've now spiraled and you think you're doomed forever. So I really like to give people this like opportunity to get to know me and be like, hey, if you have questions, like I want to help talk you off this like ledge of being scared or maybe like apprehensive. So
I love that. That's so awesome. I think it's going to be so great. So shout out August 15th at 10 a.m. It's a Saturday. Monica will be here at Avexia hosting a workshop. We'll get a link posted where you can register, because even if you're not a member of Avexia, you can come. These events are free. Or if you are a member, you can bring a friend or family member or anybody. So we just want to get the word out, get all the help that you need, and we are so excited for it.
Oh, I cannot wait.
So tell everybody where they can find you. So if they wanted to reach out to you or inquire about getting your support, where can they find you?
You can find me on Instagram. My handle is at resist.rx. That's my company's name, or online at my www.resistrx.com. You can shoot me a message and just know that I'm always there for any questions. And I always love to support and engage with all individuals. So please just reach out to me. I'm like, I know some people are always like hesitant. Like I am so jazzed when people ask me questions like, ooh, how can I help you?
You're like, I want to help you.
Like, I want to help you. Yes. Instead of being like, no, you're never going to be a burden. Like you have straight up made my day if you ask me a question, because like I want to help you and everyone else. So
love it. I love it. Awesome. Well, thank you so much for coming on. I can't wait for everybody to hear this.
Yes. Well, thank you so much for having me. It's been a lot of fun.
Awesome. This episode of the Higher Form podcast is powered by Avexia Health and Performance, your home for smart training, simple nutrition, and real accountability. Built to help you look, feel, and perform your best. Whether you're just getting started or chasing your next level, visit AvexiaKC.com to learn more and start building your higher form today.